So, hello, we have Ms. Brahmajyot with us, and we will be talking about digital health as always. So, herein we would talk about data analytics, big data analytics, small data analytics, everything will be covered. So, please stay tuned. So, first of all, I'll ask how you, ma'am.
I'm fantastic. How are you guys?
I am doing great right now. So, shooting the first question to you directly. Since we are talking about digital health and data plays a very important role in digital health, what do you think is the role of the actual data, like the data we are getting from EMRs, EHRs, and hospital, apart from that, the data we are getting from public health on streets? What could be a possible role of the data in the future of healthcare?
See, I think healthcare is a basic need of every human being,
Right.
right? But not every human being gets the same access to data,
Right.
access to health. Apologies. So, when you start capturing data and look at every single point, whether it is mobile phones, smartphones, or it is general clinician data, it's hospital data, the amount of information that you're collecting, right, from health records of individuals to
Right.
even surveys, right? So
Right.
if you ask an individual how they're feeling, like we do with corporates,
Right.
so you've got people across the universe. There are people who work in, with employers. There are people who have run their own businesses. There are people who are in agriculture. I mean, our country is quite diverse.
Right.
And all these people get some form of healthcare. If you were able to just pull in the information from all of these nodes, right?
Right.
And when you talk about information, that essentially is what it is: number of data points.
Right.
Now, that data could be in all kinds of format. It could even be a simple conversation. It could be a
Right.
WhatsApp message.
Right.
It could be, a report.
A bar graph.
It could be, yeah, well, that is the output.
Right.
But in terms of the input information that
Right.
you say I'm talking about, right? So imagine collecting all this information.
Mhm.
It will be amazing if you're able to synthesize all this information to
Right.
try and identify patterns.
Right.
Now, the patterns could be, to the point you're making, bar graph. What does the
Right.
bar graph going to tell you? The bar graph will probably tell you how people's health has deteriorated maybe over a period of time,
Right.
or how are people feeling in general, or there is a concept of transitional probability
Right.
in actuarial sciences,
Right. Right. Right.
which is a very common insurance terminology. Now, transitional probability basically says what is the probability of one person moving from one disease to another.
Right.
Okay, in insurance terms.
Right.
So I'll give you a simple example. You have a headache,
Mm-hmm.
a constant headache.
Mm-hmm.
What's the probability of that turning into a migraine?
Mm-hmm.
Right?
Mm-hmm.
Now, data and obviously medical knowledge coupled with it will be able to allow the medical practitioner, the clinician, to actually figure out, yeah, this person has a very high likelihood of getting a migraine.
Right.
How do you convert that medical practitioner's experience into, let's say, AI? We've been
Right.
talking about AI for the last 2 days,
Mhm.
right? But AI doesn't happen on its own. Artificial
Right.
intelligence uses data,
Right.
historical data of
Right.
many, many years, all
Right.
kinds of patterns, permutation combinations. It collects all that information, synthesizes it, and tries to identify emerging patterns.
The machine goes through vigorous learning.
And the learning is on the
Right.
basis of data.
Yeah, the basic data.
So
of
if you do
course.
not capture the right data
Right.
at the right point as well, you will not have AI.
Right. Of course.
Right. So I think data is really essential from that perspective. And people talk about big data, small data. Data is data.
Right.
And in the data analytics parlance, we've stopped using the term big data.
Right.
Okay, because big data essentially is, imagine a really large engine with thousands of gigs of data from
Right.
across the country
Right.
that is getting pulled into one place,
Right.
right?
Centralization of data.
And how do you use that centralized data?
Right.
Whether it's a data cube, a data lake, or wherever you're storing that information. How do you use that information to then inform the downstream analysis?
Right.
What kind of insights can you take out from that data?
Right. Right.
And
Right.
then those insights can further convert into AI.
Right.
Right? So that is a journey of data in healthcare.
Right.
And you'll have to start at the scratch. So now imagine we were discussing Tangawalas, Rickshawalas having a smartphone.
Right.
If you did have access to an app that allowed you to capture the physical being of that individual, how they're feeling at the moment, and not just physical, emotional.
Emotional.
Ask them, get a survey conducted or find a way of capturing the emotions of the individual. I'm giving you a hypothetical example.
Mm-hmm.
You can actually combine the physical and the emotional well-being quotient of that individual.
Mm-hmm.
Imagine combining that with multiple data points from 1.3 billion people across the country.
Mm-hmm.
Right? And that gives you clear patterns. So when I was discussing earlier in the forum today, in the presentation, that we actually build avatars. We build
Avatars.
personas, right? And these personas are going to be a man, aged, I'm assuming 24, right? Or 23 to 25 age group. A man is a young man. And these are the stress factors in his life at the moment. And you can actually get to that information from a number of things. You can get it from his physical, mental well-being data. You can look at it from his purchasing history.
Lifestyle,
his purchasing history. All that information can actually give you insight into how a man is feeling at the moment. And what's likely to stress him out. But to be able to synthesize that and come at that conclusion, you need millions of data points. So it needs to start with the right data capture.
But if we'll pick millions of data points, we can clone exact person, right?
Clone? Why would you want to clone somebody? A man is great as an individual.
No, as you said that we are making avatars, right? If we really want to clone someone, that could be done.
So avatar, not in terms of cloning. Avatar basically means that rather than calling Brahmajyot, okay, or rather than calling a man, you say people like Brahmajyot. Okay. We have in data science or data analysis a term called cohort.
Cohort.
Cohorts is very common in statistics in medicine as well. So cohort is what? Cohort of people, homogeneous.
Analysis,
yeah, you're doing homogeneous analysis. You're trying to find homogeneous bodies, right? So we create cohorts, and that's what we call avatars or personas, because in a number of countries around the world, and I spoke about data privacy earlier today. Data privacy basically means that as an individual, I don't want to share my health data with anybody else. And even if you've got access to my health information, let's assume that there is thyroid in my family or diabetes in my family, I don't want somebody else to know about it. It's privacy. It's very personal information to me. Because I don't want a drug manufacturer trying to sell me something in the back of that website. So data privacy allows you to de-identify the information. So you can mask the name of the individual. There's no way you can find out it's actually a man. All you will know is it's just a 24-year-old with this particular history living in some part of North India. But even that much insight is enough for the people with the right intent to build preventative care measures, etc. Am I making sense?
You are.
Yeah. So the avatar is nothing but a cohort in this case. So what we do is we try and use those data points to try and make some sense out of it. We start putting them into cohorts. And we try and see homogeneity of data points, right? And then we see, okay, is there a solution that will work for a number of cohorts? From a medical perspective.
So it can create a preventive approach.
Correct.
Rather than a curative approach.
Absolutely.
So, ma'am, since you also talked about data security and data privacy, how would you ensure data privacy if we have so much of data, right? And in the recent cases, we are hearing that people are getting hold of data as easily. People are breaching the cybersecurity of many of the organizations. So how would we ensure complete data privacy? Like, I believe it will be done in the next 10 years or 15 years. But if we are using the data right now, we also have to make it private or secure right now itself. So how would we do that? How are we thinking to do that?
First of all, I don't think we should wait 10 to 15 years. Okay, because by that time, a lot of damage would have happened already. And the world of technology is advancing by months. So we can't wait 10, 15 years. And look, honestly, a great example is financial services, banking. No one can hack into a bank account and just pull information out. Why should they be able to do that with the healthcare data? Just because the banking and financial system has implemented a set of controls. They put controls in place. They have put data protection and data security measures in place. And I spoke about data governance earlier in the forum as well. So those data governance measures have been put in place. So the way I see it is you need to have accounting and you need to have security and controls, which is basically using the right technology. Just like we use antivirus on our machine. You need a
firewalls
much larger... Firewalls are there, absolutely these anti-hacking sort of measures need to be put in place on the database or wherever the servers that are hosting your information. And on top of that, you need to have data governance and management measures. The processes that surround that technology, which is that, how often will the data be refreshed? Who has access to that data? You need to give permissions only to specific people to access some kinds of data. This happens in healthcare across the globe. Why can't it happen in India? Right? So I think there has to be some attention that needs to be given to the process. You need to invest some money and invest resources, which means the right set of people to actually build frameworks around your data. Yeah, but just giving you the banking financial services background can be picked and implemented immediately. It doesn't have to be done.
Right. But ma'am, right now, what the case that I have seen is people in healthcare are not very knowledgeable about IT. The people who are in conventional healthcare nowadays as well. and they are forced to use new softwares, new fancy softwares, which people come and sell to them, and they do not know how to store information into them. They do not know how to retrieve that information, what to do with that information, where to store that information. Some of them have a centralized approach towards information. Some of them have a decentralized approach towards the data. So, what is the right approach that one should take in order to keep the data secure, to keep the right data as well, to track the right thing as well? What is the approach one should take?
That's a very good question. I'll tell you why. Because one, the start is that doctors, hospitals, medical practitioners have the intent. They
Right.
clearly understand that there is a risk. There's a cyber risk, there's a risk to data. They understand that they can't operate anymore without digital technology support.
Right.
Which is why they meeting vendors, and vendors are able to sell something to
Right.
them.
Right.
Right? It's okay. Chuna lag gaya is a different story.
Right.
But at the same time, if the intent is there has to be some education.
Right.
Right? It's almost like saying that I have, I'm spending 5-10 lakh rupees on a software,
Right.
and then I go and cry about it. You might as well just think 3 or 4 times.
Right.
And I'm going back to a mutual fund or banking financial experience, right?
Mm.
Everybody talks about investing in SIPs today.
Right.
Why? Because it has been dumbed down to the extent that individual users in the age bracket of 20, 21, 22 can make an SIP investment today without looking at the risk.
Right.
The risk has been transferred in such a way that, and you guys are so comfortable with taking that kind of risk because the amount is small.
Right.
If you can make a direct investment in your money,
Right.
money into the market,
Right.
because everybody else, you're saying everybody else is making money.
Right.
Our markets are amazing.
Right.
Humko bhi kuch banna chahiye, let's make the investment, right? Why don't you apply the same thing to healthcare?
Right.
You have to learn, right? And if you do not wish to learn, hire somebody who knows it.
Right.
Right? You don't have to do everything yourself.
Right.
You need to hire somebody who has some understanding of it.
Right.
That is another reason why, if you remember, Dr. Hemant Kumar was talking about, how it's really important in your courses, for example, to have, or somebody in the medical professional courses, to have a course on technology.
I already had 7-8 sessions with him earlier.
Yeah,
Right.
exactly. So
Right.
he speaks
Yeah.
about this quite passionately
Yeah.
because he gets it.
Right.
So you need to have, one is you can't expect a doctor who's only done medicine for so many years to suddenly learn data
Switch to
security,
IT and
data
all.
breach. No, you can't switch.
Yeah.
First of all, they're very different sides of the brain.
And that is what I'm telling you. You can't expect a doctor to switch.
Yeah, you
suddenly,
can't.
yeah.
You can't, right?
Yeah.
So, but as I said, you have to learn some, and then you have to hire some people who know it.
Right.
You can't say, "Ki main kuch bhi nahi karunga. I'm not going to touch this."
Right.
This is the way things work,
Right.
Because otherwise, there's no way of moving forward.
Right. But ma'am, in Ayushman Bharat Digital Mission, the government is trying to make it mandate for everyone to use EHRs and EMRs in the future. Right, wherein people in the tier 1, tier 2 cities do not even know about EHR and EMR. They are still relying upon pen and paper based work. So, in order to hit the remote areas of India, what should be the right strategy?
Well, you have Aadhaar cards today,
Right.
And I think and again, I'm coming back to the point that we do not use resources that are already available to us.
Right.
Everyone has a smartphone.
Right.
If you can log into YouTube, if you can watch TikTok videos, if you can get onto Instagram and make a
Right.
video sitting in a tier 3 city,
Right.
okay, sitting in a small town in Haryana, there's no reason why you can't use that exact same technology to start maintaining health records.
Right.
It's about how you use the resources appropriately,
Right.
what framework do you put in place, what training do you invest in. And a lot of people that I've spoken to, today in particular, kept talking about how nurses do not get trained, how
Right.
medical professionals do not get trained.
Right.
They're given a software and they're said, use karo.
Right.
And this is not just a medicine issue, it's across the globe. If you
Across
give
the
any
globe, yeah.
user new software, you
Mm.
need to give some basic training to the individual
Right.
anyway. So, and Dr. Vibha mentioned earlier today that when you are sitting in an intensive care unit and you've got 14 patients that you have to look at and you're exhausted, you're not going to sit and work on an app.
Right.
And especially when you don't know how to use.
Right. Right.
So
Right.
you've got to be logical, right? When you start building these plans, you need to think through the user journey, right? And then accordingly put in elements. So,
Right.
but use resources you already have.
Right.
Why make further investments?
Like smartphones, you can get the information from just with an app. You can get as many information as you want. Apart from that, you can also ask people to put their own information in the phone, right? Their healthcare information. They can just scan their prescription and put it there,
Yeah.
right? Those could be used as EHR in the
Absolutely.
future.
Absolutely.
So
You
that
have
is
an
one thing that could be
and
done.
OCR, etc. All these are quite common these days, right? You have
Right.
enough apps that actually do recognition directly from an
Right.
Aadhaar card or whatever.
Right.
It automatically can connect to the Aadhaar database in the
Right.
back end as well. You get the data. You have some data to start with,
Right.
right? And that's the address proof of the individual. I'm just saying, there's loads of ways that you can't just say there's nothing available. There's
Right.
enough available. I'll tell you where this becomes an issue in practically implementing it, is where the data is going to be extremely unclean.
Mm-hmm.
It is going to be a nightmare to work through the data, and nobody wants to do the hard work.
Right. The data should be structured.
Unless, of course, there is a project that is released which is paying well to the individuals who are getting involved. And these could be technologists, these could be data people, these are medical people together forming that consortium. But they're all coming together and saying, we will solve the problem of electronic health records in these 3 cities.
Right.
It becomes a project.
Right.
And some money is applied towards it. People who are, and there is enough work happening. And I'm telling you this, it's so sad that we are a land of ITs, ITES and BPO. We support a number of organizations and governments across the world.
Right.
But we never use any of that talent to,
for ourselves.
For it's homegrown talent.
Right.
But we never use that talent to actually implement any tools, technology for ourselves.
Right.
It makes no sense because you're constantly being cost conscious.
Right.
You can't be cost conscious when it comes to Janta, in the citizens.
And ma'am, I'll tell you one thing. What I have analyzed is, like, cost is not the only thing. Second of all, when you apply some new technology, initial cost would be higher, but after a few years, you will see it will always be cost cutting for you.
Oh, absolutely, and there'll be payback.
Right.
In fact, because
so people do not understand this.
You would have, there's so much, and it's not just the cost benefit analysis.
Right.
It's also the advantages that you're gaining in the back end, right?
Right.
You will have electronic health records. You will be able to, somebody moves from one place to another city. You have all links to all of their health submissions and health data at a touch of a button. It's a very powerful database. There is so much you can do with that data, right? In terms of preventative care. Right. And that's a different story. If you want to pick it up and sell it to a drug manufacturer or a pharma company, it's a different story. But I'm just saying the data will be there. Right. So yeah, I think use your resources well. Put a
insurance companies are already using data.
Put some money. But insurance companies are capturing the data. At their end. They're not taking the data from you. And they've been doing it for years. That's also pen and paper, by the way.
But they also need to be focused upon their future. That is why they are doing that. They have understood this earlier only, that if we are able to track the future diseases of a certain person, then only we can insure them, and we will be able to make good profits out of them.
No. The concept of insurance is different. The concept of insurance is risk transfer.
Risk transfer, yeah.
Okay.
Pool risking
No, hear me out. So what happens is, if all 4 of us want to, insure our lives. And if one of us has to die tomorrow, you put in 100, we put in 400 rupees together. Now, when somebody dies, all of us give 400 rupees to that one person's family. The initial investment that the person made was 100 rupees, but they actually got 400 rupees. So that is the corpus that you collected. This is the concept of insurance. So if you put in that 100 rupees towards your insurance, you don't know when you're going to die. But you put it in advance so that your family, after you have gone, gets the benefit of that money. That is the concept of insurance. Insurance is never meant to be profit making. It's meant to be risk transfer. Now, the way insurance companies make money is a different conversation altogether. We can have a separate chat about it. But that is the reason why insurance companies collect data. Because before I can, make that risk transfer decision, I need to ensure that आपको cancer नहीं है. You don't have 50 issues. What if you die tomorrow and you're taking a policy today? It's a loss for the company. It's a loss for the other guys who had invested in the money.
Of course.
So that is the reason why, for risk transfer purposes, you do something known as an underwriting process, which is you identify all these risk factors. That's why the data is really important. But that is bread and butter.
That is the bread and butter
for the insurance company, which is why they can't miss that data. And there's no reason why you can't, work with insurance companies. You can't work with healthcare providers. Take all their data. Bring it all together under some sort of act that you pass that. This information has to be shared. I'm sure it's shared today with the policymakers. The government does have access to all the data.
Government does have access under the ABDM.
Correct. So then all they need to do is just bring it all together.
So
and somebody has to take a look at it, which is why I said, I raised my hand in the forum and I said, I'm the data person. You give it to somebody like a Brahmajyot, who has that mindset of data analysis and insight. We'll have to clean the data, we'll analyze it. But put somebody with a data analysis and technology background behind it and let them run with the data.
That is one cool piece of advice that one should follow, And the last question, actually it's not the question, it's an advice coming from you for the young innovators who are listening to us. Is there anything that you want to tell them? Anything that they could do in order to learn data analytics, or how this could possibly help them?
See, I think data analysis as an elective is available, I think, in every single course. Like
Right.
everybody understands.
Since the last 2 or 3 years only, ma'am.
Yeah, which is
Yeah.
fine. But there's enough courses on Udemy. There's enough, free open material to, for
Coursera
example,
and everywhere else.
Python, R. These are standard programming languages
Right.
that you can learn to, code in, right?
Right.
And with a bit of learning and then some projects that you can pick up, you can learn it. That's not a big deal. My recommendation would be that, I mean, I said in the earlier forum as well that the younger community of this country, needs to seriously think about how they're contributing towards the health of the larger country.
Right.
Okay, so you guys are the millennials. You understand technology. What we need are roles. We need people, young people, to participate in roles which are beyond the traditional medicine roles.
Right.
So data analytics in healthcare is a very, very big field in countries like the US.
Right.
It's a specialized area. There's just so much to learn. There's just so much to do, and it's a very exciting field, which is why I changed jobs to be in this role, and I'm a one-person army at the moment doing loads of things, right, in my organization. But there's immense opportunity for you to understand human behavior, apply all kinds of fancy algorithms and predictive models and deep learning in the healthcare space. It's a very rewarding career path.
It's a very important.
So, one, because you're giving back to society,
Right.
it's a space of healthcare, and second, you get into some very cool stuff, right? So, which is why my recommendation would be that why don't you actually consider, healthcare analytics as an area of practice?
And even if you do not consider healthcare analytics as an area of practice, do learn data analytics, because that would be the future for sure. You must you must know about data analytics, right, ma'am? Because nowadays, like, learning Excel is the basic need for everyone. That also comes under data analytics, right? Excel.
It's analysis.
It's analysis, yeah.
Absolutely. That's a basic
Yeah,
need of
yeah, yeah,
analysis. Yeah.
So, guys, please look into this and be serious about this for the future as well. And that was my time. Thank you, Madam Brahmajyot, for being with us and sharing such good information with us. I hope to see you again, and thanks again.
Thank you very much for having me. It was great being here. Thank you.
Thank you. Bye bye. Stay healthy.